In this video, we're going to talk about antihypertensives and hypertension. So hypertension is high blood pressure, and you can see it's broken into several stages, including pre-hypertension, and y'all can look at these levels here. But the worse the stage is, the higher the blood pressure is, the increased risk the patient has for developing heart failure, kidney failure, and damage to the eyes, increased risk for stroke. And so it's best for these patients, worst case, if we can't get their pressures to the desirable level, that they at least keep them as best they can with diet, exercise, medications. Now, what can give someone hypertension? Well, some things that we can't control, genetics and family history, specifically African Americans that are very high risk for developing hypertension. Some things that we can try to manage would be stress, and that could be eliminating stressful situations from our life as much as possible, or taking stress reduction classes. Or smoking is definitely something that we can control. Smoking actually dilates the vessels, and so that can definitely put you at risk for hypertension. Obesity, some people can manage their weights, and so physical exercise and good diet will definitely reduce your risk for hypertension. And your sodium intake, because sodium holds onto water, and so the more water and sodium you have in your body, the more that your heart has to push around the body, and so your blood pressure will rise. Signs and symptoms. Sometimes it's none, and that's why they call high blood pressure the silent killer, is because it's just something that someone can have for the majority of their life, and it's not until that high blood pressure kills off their kidneys or gives them a stroke, or they lead to heart failure, that they really see that it's been damaging them this whole time. But some patients do report headache is a big one, especially in acute hypertensive emergencies, headache, or they could have nosebleeds. And so that would be a big sign, symptom that you could see there for high blood pressures. Now here's the big important stuff here, the medications. So I'm going to cover these real quick for you and just talk a little bit about them. So you can take diuretics. If a person has too much fluid volume causing the high blood pressure, they can take diuretics, which will make them urinate the excess fluid. So there's 3 different types. You have some that hold on to potassium and some that get rid of potassium. So these typically end with I, like furosemide, actone, like aldactone, and thiazide, like hydrochlorothiazide. And so these are 3 different types of diuretics that you can have. And you want to really pay attention with all of these to this stuff in red, because this will tell you what the medicine is when you're taking the NCLEX and you see a medicine that ends with I, actone, thiazide, that you'll have an idea of what the medicine's for. When you give diuretics, you want to monitor potassium, because some of them will increase potassium, some will decrease, but some patients take diuretics. ACE inhibitors, the way these work is it works magic with the kidneys, somehow it goes to the lungs. Long story short, you can have side effects that deal with kidneys and the lungs. With the kidneys, you can have increased potassium, or it can lead to acute kidney injury. So you definitely want to avoid ACE inhibitors for patients that have acute kidney injury or chronic kidney disease. It can also lead to a nagging cough, because it does have a little bit of an effect in the lungs. The medicine is given for high blood pressure, but you want to watch out for cough, and it also has a risk for angioedema, which is almost a reaction, swelling that can close off the airway in the up here in the throat. If you can't be on ACE inhibitor, the doctor could put you on an ARB, an angiotensin II receptor blocker. It works similarly, but it doesn't have the cough problem. However, you still want to watch potassium and for angioedema with ARBs. ACE inhibitors end with pril, and ARBs end with sartan, like losartan or lisinopril. Beta blockers are pretty important here. They end with LOL, metoprolol, labetalol. And these also can decrease the heart rate and control dysrhythmias. So that is a very good use of beta blockers. However, they can cause erectile dysfunction, and they can mask the signs of hypoglycemia in a diabetic. So it's important to educate those diabetics about other signs besides tachycardia that they could look out for a hypoglycemic event. And calcium channel blocker ends with pine, like amlodipine. And with these, you want to be sure, like all of them, check blood pressures and heart rates. And you want to avoid it in grapefruit juice, because it can affect the amount that the patient will receive. And so that's a quick summary of these medications.